Hello and welcome to Empowering Aesthetic Excellence. And in today's episode of the Aesthetic Dialogues, our guest today is Dr. Sujatha Chandrappa. She is an expert Indian aesthetic practitioner in cosmetology and trichology and a trainer of the prestigious Allergan Medical Institute. She is an alumni of the prestigious American Academy of Aesthetic Medicine. She has nearly 25 years of experience as a medical professional in India. And over the last 19 years, she has specialized in non surgical, non invasive facial and body aesthetics. She is today a leading expert in the field of advanced dermal cosmetology and laser applications for aesthetic treatments and practice a wide gamut of advanced non-surgical and photo procedures. She has been trained by some of the world's leading experts in the field and has the experience of working with large and rapidly growing base of extremely satisfied clients in her practice. She has nearly 9 years of corporate experience and is the medical director and founder of the R3 Clinic. She has a well-established private practice for more than a decade. She has trained approximately more than 1,000 doctors in injectable aesthetic procedures over the last 15 years and has worked and consulted with leading players like VLCC, Allergan, Kaya, and other aesthetic chains and clinics of repute. She has published various articles and interviews in leading domestic and international newspapers, magazines, news channels such as Indian Express, Asian Age, Deccan Chronicle, Bangalore Mirror, Health and Nutrition, Be Positive, Femina, Brown Girl, which is an Australian magazine, Juggernaut Publications, CNN Style, and MosaicScience.in documentary in Bloomberg News, etc. So, without any further delay, let's welcome our guest for today, Dr. Sujatha Chandrappa. Hi, Dr. Sujatha. Welcome to the Aesthetic Dialogues. It's lovely to have you here and get your insights on the various aspects of aesthetics, medical facial aesthetics.
Thank you, Dr. Bhavna. Thank you for having me here.
So, without any further delay, let's get into the questions. Are you ready?
Yeah, sure. Please go ahead.
Okay, right. So, you have been a trailblazer in the aesthetic medicine space. And reflecting on your illustrious career, what do you attribute as a primary catalyst in shaping your journey? Was it a stroke of luck, or was it the hand of destiny guiding your path? Was it some conscious efforts and strategic choices, or some invaluable guidance from your influential figures in the industry? So, what is it that shaped your career?
Well, it's a long story, but let me give you the gist of how my journey has been and how it began. To start with, I was working in a hospital in the capacity of a casualty medical officer, handling, as you would know, handling all kinds of emergencies, whether it's labor or burns patient or trauma cases, whatever the cases, emergency. So I was busy doing all of that, and I did pretty much of that for almost 8 years when I started my career. And then, as destiny would have it, I joined VLCC, and I thought it was a good, refreshing break from what I had been doing for many years. And when I joined VLCC in the year 2005, so it's been about 19 years that I began my aesthetic career. So I worked for VLCC, wherein we had very few limited aesthetic treatments at that time. We had our laser, we had chemical peels, and we had simple procedures like wart removal or electrocautery or radiofrequency. So these were the few limited treatments that we had at that time. And after I worked there for 3 years, then I got a break wherein I joined Allergan as a medical affairs manager for South India. And there my main or primary roles were to interface with the doctors. It could be aestheticians, it could be dermatologists or plastic surgeons, and a few ophthalmologists as well. So my main role was to support them with injection techniques, training programs, clinical publications, so on and so forth. So I was totally into medical affairs for 4 years. And then again, as destiny would have it, I got a big break in VLCC in the capacity of medical affairs head for South India, wherein I was mainly practicing medical aesthetics. So then there were a lot of new treatments which had been introduced at that time. I also looked at facial and body aesthetics. My role was to manage a team, to interview doctors, recruitments, training, writing protocols for facial injectables, Botox, fillers. And I also got trained with the latest innovative treatments in medical aesthetics. So I worked there for 2 years. So total corporate experience has been 9 years. And then I said, okay, I think I did enough of everything. So then I was wanting to set up my private practice at the time. So it's been almost a decade now. And then I set up my private practice, which is now called R3 Clinic. And I thoroughly enjoy my private practice. At the same time, I still consult for Allergan and VLCC, and wherein I conduct treatments as well as trainings for both these organizations. And I also have my bit of private practice. So I even before I knew it, at some point, yes, of course, at some point it became a conscious effort for me to retain my practice or my association with the medical aesthetics. And but to begin with, it was purely maybe destined to happen. So that's a little bit about me.
Oh, wow, that's an amazing and wonderful career in aesthetics. And it must have been a really shift, a big shift from, going from a casualty officer, which is a very hectic, field, to an aesthetic space, which is a bit relaxed. So there must have been a big mindset shift in switching the roles, I guess. But
Yes, definitely. Definitely, I feel that when I switched to aesthetics from what I was doing for almost 8 years, it was a paradigm shift, and my way of looking at patients changed. Because here it's not just the physical aspect of it. You're also trying to deal with patients who lack self-confidence, self-esteem, and they need a lot of reassurance and counseling at some point. So it's not just the treatment per se, but yes, you're looking at much more things. But yes, it was far more relaxed than what it used to be. Definitely it was a huge paradigm shift in my practice.
and you've done it really well, I guess.
Thank you so much.
So, as you mentioned before, like in your aesthetic practice, you must have witnessed profound transformations both in the appearances and the lives of individuals whom you work with. So how do you perceive the expansive beauty landscape? Is it just a surface level pursuit of aesthetics, or do you believe there is a deeper significance which is multidimensional that transcends into physical appearance?
Definitely, because like I just said, when we are dealing with the patients, it could be men or women, especially women, because they have a certain phase of their life wherein they go through huge changes in their physical and mental state. And it could be women of perimenopausal or menopausal or postmenopausal age group. So they deal with lots of issues physically, like they look bloated. They have skin issues, pigmentation issues. There is thinning of hair. They have a lot of mood swings and hot flushes and so on and so forth. So they constantly having to deal with lots of changes that's going on internally as well as externally. So when we have to deal with such patients, we also need to reassure them that it's okay to go through what you're going through, because there is a severe depletion of estrogen concentration in your blood. And obviously, it's going to bring about lots of changes in everything. So it's good to accept it and embrace it at a certain point. So I think it goes much more beyond than just treating their physical appearance, which is to reassure and counsel them and try to empower them with low self-confidence and self-esteem. So we also are dealing with their physical and mental state. So it goes much more beyond just improving their physical well-being. And so at the same time, even when you get younger girls, who are marriageable age, they
Right.
are also lacking self-confidence and self-esteem, but more so in the older women or the older generation. So it's also so our role is to go much beyond that, just the physical appearance.
Very true. Very, very nicely explained. So, in your extensive experience, what discernible red flags have you accumulated over the years, uh, which serve as a reliable indicator of clients' potential suitability or unsuitability for them to be your patient or for a particular treatment? And how do these flags provide insight into the quality of client-practitioner relationship?
That's a very, very important question. And I would definitely be happy to answer that question. Now, there are certain red flags that I look for in the patient when they walk in. Okay, now sometimes we get patients who are a little, fussy,
Yeah.
or what you call them, the irate patients category.
Right.
They are, if they come for a facial injectable procedure, let's say, I'm just giving you an example.
Yeah.
There could be many more red flags of this kind. So let us assume that they walk in for a facial injectable procedure. So there are certain adverse reactions or adverse effects or, transient side effects that one can expect, which is a little bit of redness or swelling or bleeding or bruising, etc.
Not side effects. They're
So
part of the process, I guess.
yes, those are transient. It's just there for a few hours.
Yeah.
But sometimes they could think that you don't have any telltale signs. There could be a little bit of transient issues, but their expectations are very high, and they're not willing to understand that this is a part of the whole process or the whole treatment.
Right.
So that would be a little bit of a gray area for me, whether to accept such patients in my practice,
Right.
or whether how do we deal with them, and how are we going to counsel them. So that is a slightly gray area for me.
Right.
And at the same time, sometimes we get patients who have very high expectations.
Right.
They think every treatment is different, as you would know, because every treatment has their own benefits. Okay,
Right.
so sometimes you get patients who want you to advise them for one particular treatment, and they think that all their issues are going to be fixed,
All. Yes. Right.
right? So they think a chemical peel can fix up a aging issue,
Yeah.
or can fix up the facial lines,
Right.
can give them a lifting,
Hmm.
whatever it is. So they think just one treatment can fix up a whole lot of issues. So in short, I would say they have too high expectations,
Yeah.
and sometimes we are a little hesitant to accept such patients because we know there is not one thing in particular that can fix up everything. So
Right.
I would be a little wary of such patients. There is another third category of patients who say, who get the picture of their
Yeah.
favorite
Celebrity
celebrity or
faces.
model,
Yeah.
and
Yeah.
say, make me look like this.
It's
And
not.
you can,
No, this is
I
trouble.
encourage them. Absolutely, you can make them a better version of themselves, but you
Yeah.
can't make them look like somebody else, right? So
Yes.
those are the slight red flags that I would trade with a lot of caution.
So before the
Yeah,
skin
so
scan begins, there's some other scan, already done.
absolutely. So I take into account all their expectations. I take into account what is their motivation to get a certain treatment done. So all of these factors do count.
Right, right. So, very well. So, what would be your advice to someone who is wanting to pursue aesthetics as their career? As you've been mentor to so many doctors I've known, including me. So, what would be your advice at this point?
Okay. Okay, that's a very good question, which most doctors trying to enter into private, a facial aesthetic practice should be aware of. First and foremost, I would think that most aestheticians or most doctors who want to get into this industry have a lot of misconceptions, because they think that it's very simple, it's very easy, and
Very glamorous. That
they could venture into it. So my first and foremost advice would be for them to be associated or work with a clinician or a practitioner who has some level of expertise in this field, so that they understand the tricks of the trade. They could be wanting there's so many things, whether it's about
not just
facial
the skill,
anatomy,
but
whether
how you put forward that skill, package
absolutely.
everything. That is more important to learn when you're doing a practice, I guess.
Absolutely. So there are various aspects to it. So it's good to associate themselves with with a good name in the field,
Yeah.
and work with them for a certain period, so that they understand how to go about it.
Right.
And they have to be open to the process of learning. Like any other medical profession, it has to be an ongoing journey, whether it's about latest techniques. Because what I learned about 15 years ago, the techniques are totally different from what I
Different.
practice today. So there are going to be constant skill upgradation programs that you need to, attain. Um, Thirdly, I would say that it's always good to plan some kind of a certification course or program, depending on your areas of interest, and then take the leap.
Right. So I hope this helps a lot of people, because I've seen people just opening up clinics. They've just cleared their medical education. They've started their clinics, and because these industry people, they approach them, and they get started with one procedure, and they just take off, like that. So that and they end up in a lot of trouble then later on, because experience is something.
Absolutely. I see so many budding practitioners, they just set up their clinics. And, even where I practice just down the street, there's so many clinics which open and shut in a few years' time.
Yes,
So
yes.
it's kind of difficult for them to balance things. So I would always say it's always good to go a little slow when it comes to setting up your own private practice.
Right. Very true. Now, what notable distinctions have you observed in attitudes and preferences of the younger generation when considering injectables as compared to those with their parents' generation?
That's a practical question, because there are quite a few notable differences that, in my observation, if you actually broadly categorize the patients, the youngsters would be mainly the Gen Z category, or
Right.
what you call the millennials.
Yeah.
Which the Gen Z would be somewhere in the age group of 12 to 27.
Yeah.
Millennials would be somewhere till the age of 28 to 43 or 44.
Right.
And then comes our age group, wherein we would be called the
Baby
Gen
boomers.
X category. And then you have the baby boomers. So if you broadly categorize them, there would be four category of patients that we encounter in our practice.
Right.
So I would say the Gen Z category and the millennials are the ones who would be mainly looking for enhancement of facial features, whether it's a sharp nose, or whether it is, lip reshaping or lip augmentation, having a well-defined jawline. So that would mainly count as a rejuvenation plan.
Yeah. Right.
Okay, so they are
Enhancement.
mainly
Some
making,
kind of,
or maybe an eyebrow lift.
yeah.
Yeah. So their attitude would be mainly to enhance their facial beauty or rejuvenate themselves. Whereas the other category of patients, which is the Gen X and the baby boomers, they would mainly look at restoration of beauty. Maybe whether it's a overhanging jowl or an ill-defined jawline, or whether it is under eye hollows or what you call the tear trough deformity. So they would come with mainly those kinds of concerns. So this is based on the attitudes. This differentiation is clearly based on the attitudes. Now, how different they are in terms of making up their mind. Okay. The first two categories would primarily be more open to try different treatments. They would go by whatever you would have advised them. They're willing to do it all or try it all. Of course, again, based on the dispensable income. Whereas the older patients, they have a lot of disposable income. They are financially well settled, well to do, but they are very slow decision makers when it comes to the treatments. They're a little bit slow with the decision making process, but they are also open to try, but they would go a little slow. So this is the basic differences that I have observed.
Right. Yeah. Okay, great. Now, what is the most challenging indication you feel that the beginners should always stay away from?
Okay. We come across a lot of complications. I get a lot of phone calls from my colleagues from the industry, and they say, okay, I have had this complication. How should I go about it? Or how should I deal with it? So it's always important to not just know about how you're going to treat a certain indication. It's also important to understand, if you get into a complication, how are we going to deal with it? Okay. So this is the basic thing. Now, as beginners, there are a few indications that one must completely avoid till they understand how to go about the basic indications. If you talk about indication wise, I would say the beginners should always venture into basic and intermediate indications, whereas the well-established practitioners can try to go for advanced indications. So anything that's got to do with the midline of the face, like for instance, the nose reshaping, like for instance, the lip augmentation or the lip
The under eye
reshaping.
also, I guess, is a bit complicated.
Yes, the teardrop area. These are all, issues which are in the central portion of the face. So beginners should best avoid them unless they're more confident with the lateral indications, which is the cheek lifting or the temples or the jawline or the chin. So these are more safer to venture out as beginners than the midline of the face. So it's once you have done a good number of patients with the basic and the intermediate, then it's good to go for advanced.
Wow, that is nice. Very, very helpful information. Now, what are the specific indications that you have found to be most challenging, and conversely the most straightforward? So most challenging you've already mentioned. So what are the most straightforward? Obviously, I think the lateral ones are the straightforward.
Yes. If I were to add something to it, I think the most simplest facial injectable procedure would be the Botox treatment for the upper face.
Upper face.
Because the doses are fixed, the injection points are fixed. So there is, hardly any
customization is not required. Much customization is not required. Everything is straightforward.
Absolutely. Absolutely.
Right. So now, name a few celebrities that you feel have set bad examples, and few celebrities who are good examples and who have set benchmarks for others with the facial treatments.
Okay. I'm sure all of us would have observed over time that there are certain celebrities, without naming them, there are certain celebrities who look very bloated, who look very puffed up, who look overdone. And, for them, even to smile or to make a facial expression or animation is very difficult because they are so stretched. The faces are so heavy, so bloated, so puffed up. They look so edematous. So that looks a little unnatural and, unacceptable, because subtle enhancements are always better than make them look artificial. So there are a lot of faces in Bollywood as well as in Hollywood that I keep observing.
Right.
They don't know where to draw the line.
Yeah.
They start to overstep,
Mhm.
and then all the issues start.
I
When I talk about the good faces in, if I were to talk
I guess
about
you can
Bollywood,
name them.
yeah, there's some good, really good, well done faces in Bollywood are, I would say, Alia Bhatt.
Yeah.
She looks very natural
Mm.
and very subtly done, very well treated. So whoever is doing her face has done a good job. And then there is Deepika Padukone.
Yeah.
She also looks very natural.
Yeah.
I think faces like these can be really good examples.
Right.
But bloated faces is a total no-no or unacceptable trend, I should say.
Right. Right. Great. So now, this aging gracefully, the concept of aging gracefully has, various layers to it. Accepting yourself, the way you are, is also aging gracefully. Doing certain tweakments which keep you looking natural, the way you were 10 years back, is also aging gracefully. So, what is your take on this, and how do you navigate this delicate balance between acceptance and intervention in your practice?
Uh, if you actually ask my personal opinion,
Yeah.
I would say there is no such thing as aging gracefully.
Right. Right.
Okay. At some point, we all need some intervention,
Right.
because my belief is that nobody is born perfect
Hmm.
and nobody is going to live perfect,
Right.
right? We
Right.
always need some intervention with various parameters of the face, whether it is about treatment for pigmentation, whether
Right.
it's the facial lines wherein we do your Botox,
So,
whether you have a sagginess of the face, or whether it's a nose job or a lip job or sagginess issues or tear trough issues. So we need some kind of intervention at any given point of time, because like I said, it's not possible for any face to be perfect for that matter, and
right.
even
Right.
skin to be perfect for that matter.
Right.
So we all need enhancements from time to time.
Yeah. So I guess even makeup is a kind of intervention only. It's just it's delivered in a different way. When people put makeup,
Absolutely.
that is also intervention.
Absolutely. So that's what I keep encouraging my patients. I say, with makeup, the makeup should be used to enhance yourself.
Right.
Makeup should not be used,
Right.
as an antidote or a quick fix to your issues,
Yeah.
right?
Very true.
So if you're going to think that I have a bad tear trough
Mhm.
deformity or an under eye hollow, and if I think that I'm going to apply makeup and I'm going to look good, I
Right.
think that's not the right
Right
concept, or
approach.
that's not the right way to go.
Go about.
My thinking would be, makeup is best used to enhance your face.
Not to hide behind it.
Absolutely, not to hide your flaws. In
Right.
fact, we have a in clinic, promotional material which says why use makeup
Yeah.
to hide your under eye deformity when you can get it treated.
Yeah, very true. Yes. So people have to understand the concept behind this intervention. If they're open to doing a lot of makeup, they should be open to, I think, injectables also. It is just a different way of intervention. And that's
Absolutely.
what
In
more.
fact, I would like to narrate an incident wherein, a model walks into my clinic, and she says, when I was in the process of shooting, my photographer told me that you have an under eye hollow, which is difficult to hide with makeup,
Mhm.
which is difficult to hide on the camera. No
Yeah.
matter how much light I use, or, focus lights I use, no matter what angle I use with the camera, it's still visible. So why don't you go and get it treated?
Yeah.
So, like I said, makeup cannot hide all the flaws, but
Every-
yes, it
Yes.
can hide few of the flaws that we have. So I think it's best to use makeup to highlight your beauty.
Highlight, definitely. And mostly makeup is required to, fit into that camera image. Otherwise, I don't think people naturally who are walking around need any makeup. It's just to cater to the cameras and all.
Yeah, right. Very well said.
Okay. Now, one last question. And what is the one most overrated and most underrated treatment in facial aesthetics as of now?
Okay. See, I don't think there is anything called overrated or underrated treatments, because every treatment has a definite purpose,
Right.
right? Has a
Mhm.
definite reason why we are going to do it, right?
Right.
But however, many patients I see come with a certain mindset. It's about mindset, right?
Right. Right.
There are patients, there are phases of every treatment, there is a phase of hydrofacial. Suddenly, everybody who
I
walked
think it
in
was
wanted
more
to
of
do a
market driven,
hydrofacial.
marketing driven.
Absolutely. Yeah. It's a boom. Then
Yeah.
they say, oh, everybody. And then, after a few years, your hydrofacial is just going to be dumped in your clinic.
Yeah. Yeah.
So, so every treatment serves a definite purpose,
Right.
right? In my opinion, what I would call as the most overrated treatment would be something that's called thread lifting. There was a phase when,
Right.
everybody wanted to do
Bit.
thread
Yeah,
lifting.
there a phase comes.
And
I can totally relate
exactly.
with it. Hydra facial. Now everybody's asking for IFU.
Exactly. So, there are phases of those treatments.
Yeah.
So there was a phase when everybody wanted to do a thread lifting.
Yeah.
Yeah, maybe because I wrote a certain article in some newspapers which talked about thread lifting procedure.
Right.
Around that time, there was a big boom about thread lifting. But
Thread.
what the patients fails to understand
Yeah.
is that thread lifting is going to help us to address some amount of sagginess, and
Yeah.
it's going to kind of lift and anchor the facial tissues. But
Right.
it cannot contour the whole face, right? It
Exactly.
cannot make your lips a certain way or a nose a certain way, or eyebrows a certain way, or your temples a certain way. So there is a limitation about what thread lift can offer.
Yeah.
So suddenly there was a lot of, and I failed to understand why everybody is wanting to go for a thread lift, and their
Okay.
expectations are different. Yeah.
Everybody has
So
different
so
taste,
that
different
was,
aging.
yeah, absolutely. So that was, I think, even today, that's a little bit of overrated treatment. When it comes to addressing all the facial aging signs, it
Right.
doesn't work that way. The patient thinks. And what is the most underrated treatment for me? I think it's a simple chemical peel. Most,
Right.
patients fail to understand the benefit of
Yeah.
a chemical peel.
Yeah.
I think every monthly, as a skin rejuvenation plan, every patient must go in for
Hmm.
a chemical peel
Yeah. A basic one is
treatment,
also good enough, if not very
depending on their
intense.
skin issues.
Yeah.
Yeah.
Okay, so that was such a lovely conversation with you. Love talking to you and having your insights. So thank you so much for your time, and I'll be catching up with you in future also.
Thank you,
Thanks.
Dr. Bhavna. Thank you for inviting me. Thank you for having me here. Lovely talking to you.
Most welcome. Bye bye. Good day. Take care.
Bye bye. You too. Have a nice day. Bye.